Hi, welcome to OBGYN Academics. In this presentation, we are going to see what different types of ureteric injuries are common while surgery. Name of the topic is nature of ureteric injuries. First common variation is kinking or angulation. This mostly arises because of the anatomical nature of a ureter, as ureter is typically free on upper side and typically fixed at lower side. That helps in the respiration, movement, and when abdominal girth is increased during pregnancy, it gets stretched up. So regular kinking is commonly present in normal pregnancy. It has got no clinical significance as such. This is diagnosed only on sonography or radiologically. There are generally three types of kinking which is very commonly seen. First is grade 1, that is no kinking or mild kinking. Second grade is a moderate kinking or containing horizontal portion. Third grade is severe kinking or containing retrograde portion. These common variations are there. We cannot call it as an abnormality, but as a normal routine we should be able to understand what is abnormal ureteric variation and normal ureteric variation. For first 2 or 3 grades there is no need of any specific treatment. Another common type of ureteric injury is ischemic injury. When we are doing surgery close to ureter, when we are dissecting it from the peritoneum, as we know, ureter gets its blood supply from the periphery, and when we are denuding the ureter, so we are hampering the blood supply, or we are causing trauma to ureteric sheath that reduces the blood supply, and because of that it will have some ischemic injuries. When there are some ischemic injuries to the ureter, eventually that will lead to weakness of that portion of a ureter. There could be a vascular necrosis which is possible, and from that avascular necrosis there is some extravasation of a urine into peritoneal tissues and adjacent organ and in retroperitoneal tissues. So you should be able to know that what kind of injury you have created. Another common type of injury what we are doing is ligature incorporation. Suppose we are operating on a large cervical fibroid and we are taking a stitch on the lateral wall of a uterus that is close to uterine artery. As we know, a ureter lies just 1.5 centimeter lateral to the uterine artery. So when we are taking stitches at the uterine artery level, we are taking the tissues along with the uterine artery just to give compression support, and uterine artery is lateralized because of size of a fibroid. In that situation we can accidentally ligate the part of a ureter. So we should be able to identify that you ligated a part of ureter. So when you diagnose it on table, you can just remove the ligature and patient will be all right. When accidentally ligature is put on the ureter and ureter is kinked or compressed, there will be a persistent pain in abdomen because all urinary stasis occurs at the upper level. There will be mass felt in the flank. There will be prolonged ileus. There will be urinary tract infection or hydronephrosis or elevated creatinine and blood urea nitrogen. These are the symptoms when you ligate the ureter. Another type of injury is crushing injury, that is caused by accidentally holding or crushing the ureter. So when you are applying a clamp for hysterectomy, when you are crushing the tissues, accidentally if you crush the ureter, so necrosis can happen in that part. So that you can identify on the table or sometimes in post-op period. Immediately you may not be able to understand that you have crushed the ureter, it has started leaking. So when you do this kind of injury, patient will have pain in abdomen or the area between the ribs and hip, that is in flank area, and sometimes you might notice urine leaking from their wound because the ureter is open. So whatever urine is created by kidneys, those are poured into the peritoneum, and that can come out from the wart. after hysterectomy. So if this happens for a longer time, patient will complain about fever, there will be infection, and patient will complain about persistent urinary leak. Another issue is transection of a ureter. It could be a partial transection or it could be a complete transection. When you are cutting any tissues in the retroperitoneal area, suppose you are doing internal iliac artery ligation and you are not familiar that ureter course. So in that situation, in case when you are opening a peritoneum, that time accidentally you can cut ureter, that is partially cut or completely cut. So in that situation, you might see urine coming out of your cut portion of a ureter. So when you do it, patient will complaining of flank pain, prolonged iletus, patient will have fever, patient can have watery vaginal discharge or elevated serum and creatinine level. Last but not the least, that is thermal injuries. These kinds of injuries are very commonly seen in nowadays because recently last 5 to 10 years there is a rapid increase in laparoscopic surgeries. So in laparoscopic surgeries for cutting and for coagulating, different types of energy sources which are used. So if you are using energy sources which are electrical, that will have some of the lateral spread of the current, and if that lateral spread of current is going towards the ureter, that can involve the ureter and that could cause a thermal injury to the ureter. Worst part of these kinds of injuries, those injuries are not generally identified on the table. Those will come after a 3-4 days or after a week of a surgery, when patient will come to you with the symptoms that pain in abdomen or persistent leaking of urine through vagina. You should be able to identify what kind of injuries are happening in the operation theater. You should be able to prevent those kind of injuries. Thank you.